everyone. Okay, so we are starting the preparation for gynae talks. We will complete this preparation in 3 steps. In the first step, we will discuss the important instruments. In the second step, we will discuss the important counseling stations. In the third section, we will discuss some pictures of important diseases that are common in gynecology. So, starting from the instruments, the first instrument is speculum. This is speculums, and for what it is used to retract the vaginal wall and to visualize cervix. For example, this is vagina, and these are the anterior and posterior lips of vagina. So this speculum's one portion is inserted here, and the vaginal walls are retracted. So this is used to visualize the cervix. The second instrument is duct speculum. It is a self-retaining speculum. The same speculum was not a self-retaining. It required an attendant or someone to hold it. The second instrument, that is duct speculum, is a self-retaining speculum, and it is used to retract the two vaginal walls, anterior and posterior. This is the vaginal wall, so this is the anterior and this is the posterior portion. This same speculum is inserted here, and it is pressed here, and it is opened, and the vaginal walls are retracted. So this is used to visualize the cervix and vagina, and it is used for procedures of biopsy and curettage. Whenever biopsy is required, duct speculum is inserted in the vagina, and the biopsy is taken or curettage is done. The third instrument is valsalum forceps. This is the valsalum forceps. The identification point is that there is space between its two blades. These are the two blades. Here we are having some space, and there are teeth at the holding it. This is the holding it. The small teeth are present here. So this is the valsalum forceps identification point. What are its uses? It is used for holding anterior lip of cervix in procedures, that is evacuation and curettage, cervical biopsy and hysterectomy. Okay, this is used to hold the anterior lip of, let's suppose this is cervix, this is the anterior lip, so we will hold with this teeth portion this lip, and it is used in the procedures, that is evacuation and curettage. Whenever evacuation and curettage is happening inside the uterus or cervix, so this is used to hold the anterior lip of the cervix. This is used also in the procedure of cervical biopsy and hysterectomy. So the general function of valsalum forceps is to hold something, soft tissues or etc., that is anterior lip of the cervix, etc. Okay, the next instrument is sponge holding forceps. This is a sponge holding forceps. We are having a small opening like space here, and it is used for holding soft tissues in placental piece, exploration of genital tract, cervix for tear after delivery. Okay, this is a sponge holding forceps. Sponge holding means it is used for the holding of soft tissues. For example, placental piece, and it is used for the exploration of genital tract. For example, if we want to see inside the genital tract that whether polyps are present or whether the infection is present, etc., so we will use the sponge holding forceps for the holding of soft tissues. Okay, the next instrument, this is the sponge holding forceps. This is the another view. It is this looking like this. We are having opening here. Okay, the next instrument is Hager's or cervical dilator. It is used to induce cervical dilation in order to gain entry to interior of uterus. Whenever curettage or biopsy we want to take, or we want to see the internal genital tract, this Hager dilator is inserted inside the uterus, and it is used to dilate the cervix. Then the procedure is done. So it is used to induce cervical dilation in order to gain entry to the interior of the uterus. This is uterine sound. We are having some markings on it. This is from start here. These are the small markings you can see here. It is used to measure the uterine cavity before intrauterine device to prevent perforation. It has graduations. Okay, if we want to insert the intrauterine device inside the uterus, so it is important first to measure the size of the uterus, that how much deep it is. So uterine sound is inserted first, and the length of the uterus or size of the uterus is measured, and then intrauterine device is inserted. So this is for this purpose. The next instrument, this is also the uterine sound. This is the another view. Okay, this is the curette. This is curette. We are having two openings like spaces here, and it is used for scraping the tissues for endometrial biopsy and cleaning procedures. Okay, whenever biopsy is required, we will use this portion to take the biopsy, and also we can use this for cleaning. One end is sharp and the other one is blunt. Biopsy should be taken from all four walls of uterus. Okay, should be noted. Whenever we need to take the biopsy, this portion is used, and the biopsy is taken from all walls of the uterus. What are the complications of curate? It can perforate uterus. Escherman syndrome, intrauterine adhesions can appear due to the use of this curate. The next one is Coker's forceps, also known as amniotomy forceps. These have curve-like teeth here. This is Coker's forceps. Coker's teeth. Just remember it like this. It is used for artificial rupture of membranes for augmentation of labor in active phase of stage 1. Okay, for what purpose Coker's forceps is used? It is used for the induction of labor. Induction of labor is done either in postpartum female or in the active first stage of labor, when labor is started and it is the time to deliver the baby. So the artificial rupture of membrane is done through this instrument that is known as Coker's forceps or amniotomy forceps, and the identification point is that it consists of curved teeth. Okay. Okay, the next one is needle holding forceps. This is a small scissor-like thing and having small two hooks here. It is used to hold a suturing needle during surgical procedure, for example, episiotomy. Episiotomy is the cutting of vaginal wall or cervix hair. A small cut is given here, and for that purpose, this needle holding forceps is used to hold the needle during the process. The identification point is that it consists of small mouth part that is smaller than hysterectomy clamp and crisscross and vertical grooves. In this portion, we are having crisscross or vertical grooves. As shown in this, these are crisscross and vertical grooves. Okay, this is the needle holding forceps. It is used to hold the needles during the episiotomy or any other procedures of the gynae. This is hysterectomy clamp. It is used to clamp the blood vessels and uterine ligaments during surgical procedures. This is used for clamping. This is hysterectomy clamp. Mouth part bigger in size than needle holder. As we discussed above, this is the needle holder. In the hysterectomy clamp, this mouth part is a little bit bigger than that of needle holder, and it is only horizontal grooves. No vertical grooves are present. In the needle holding forceps, there were crisscross grooves present like this, but in the hysterectomy clamp, only this type of grooves, that is horizontal grooves, are present, and it is used to clamp the blood vessels and uterine ligaments during surgical procedures. The next instrument is straight and curved artery forceps. These are artery forceps. This is the straight artery forceps and curved artery forceps. It is used to secure hemostasis during surgical procedures, and the identification are that is smaller than a needle holder. These hooks are smaller than needle holder. Difference between this is small amniotomy forceps. Later one has teeth. Okay. This is Coker's forceps, as we discussed about amniotomy forceps, but this is a small in size and it is used to for the artificial rupture of membrane. These are artery forceps. This is amniotomy forceps. You can see the difference. These are straight, but the amniotomy forceps is curved in shape, and it consists of a teeth-like appearance, while artery forceps doesn't have that. This is the episiotomy scissor. It is used to give an elective incision in the perineum in the second stage of labor at the time of crowning to facilitate the delivery. When the delivery is struck or there is obstructed labor and there is crowning of the baby, that is the head is stuck in the cervix, so episiotomy scissor is used to give incision in that place, and that process is known as episiotomy, and this is an instrument which is called episiotomy scissors or scissor. Okay, what is the complication? Bleeding, hematoma, pain and infection can occur. Okay, this is the next step is the tooth forceps, and it is used to hold the skin or needle during surgical procedures. Okay, if you need to hold the skin, then tooth forceps can be used. It is having a small tooth and it is just like a in shape of placard. This is the teeth appearance of the hook tooth forceps. Okay, for the gynae talks, all the instruments should be remember with its uses. That first of all, you have to identify the name. That what is the name of the instrument, then its uses, that for what purposes or in which procedures they are used, and then you should know the complications of each instrument. So the complications of all instruments are nearly same. That is, it can cause trauma, it can cause bleeding, it can cause infection, it can cause perforation, and etc. Okay, these are the most common complications of the instrument. And the identification point, you should compare all the instruments with each other, and just thus it can help you to identify the instrument from each other, that which one is curved, which one is straight, which one is sponge holding, or which one is the simple scissor, which one is the amniotomy forceps, and thus you can differentiate the instruments among each other and can learn it easily. The names, uses, and complications are very important for the instruments to prepare for the gynae talks.